Oh, good morning, everybody. Hello. It is 10:01. That means it is time to jump in. I am Frank Wiley, 10 Tampa Bay Brightside anchor. Definitely a pleasure to hang out with you this morning, to be your host for what is going to be an insightful conversation, important one, revealing discussion about our community, our families, and of course, us, the role that we play. Now, we're going to center this conversation on the 2023 ALICE report. Came out less than a month ago. So it's a collaborative effort between the United Way Suncoast and its research partner, United for ALICE. That report revealed that the ranks of Florida households unable to afford the basics, that rose to 3.8 million during the pandemic. Within United Way Suncoast 5-county footprint, well, Hillsborough, Pinellas, Manatee, Sarasota, and DeSoto counties, that number, if you can believe this, sits at 615,627 households, or 44% of our overall population. I can vouch for this because we've covered several stories here. Now, United Way Suncoast deemed this virtual presentation, We Are ALICE. Might be wondering, who is ALICE? Well, they deemed it that because it recognizes the success of our children, parents, and community members. All of it hinges on a collective effort, a collaborative effort. So, who is ALICE, right? ALICE is an acronym for Asset Limited Income Constrained Employed Families. Again, ALICE is an acronym that stands for Asset Limited Income Constrained Employed Families. And get this, the new 2023 ALICE report revealed that on the Suncoast, a family of 4 with an infant and a preschooler must make $88,000 annually to live comfortably. And we know comfort is always relative. So that can also be a deceiving word. ALICE families span all races, ages, ethnicities, and abilities. And ALICE families often work 2 or more jobs and still can't pay the bills. We've talked a lot about inflation right here on my show. Now, ALICE families count the days between paychecks, and ALICE families live a life of struggle, but our communities can live, or can't, I should say, our communities cannot live without those resources. So if we truly embrace the word community, if we honestly believe we are in this together, then hence the name, We Are ALICE. United Way Suncoast carries this belief into everything that it does, but we know that everybody has to be involved to make this happen. So today we're going to hear from an esteemed group of panelists, but we all know that we play a big role in this and supporting ALICE. But first, I want to bring in United Way Suncoast Vice President of Community Impact, Doug Griesenauer, to help us better understand the results of the 2023 ALICE report. All right, Doug, thank you so much for hanging with us this morning.
Thanks for having me, Frank.
Absolutely. So, Doug, the ALICE report comes out every 2 years, but we've talked about this as well. It was delayed because of the pandemic, something that has touched every household. So now we have a new snapshot of how many families out there in our region are dealing with the daily storms that we're talking about, with these struggles with inflation, food, gas, and everything in between. So I got to ask you this. The number of ALICE families increased in our region. How does that designation actually relate to the federal poverty line?
Sure. So when we look at the ALICE report, as you mentioned, 615,000 households in our communities are struggling. That's
Right.
If you were to fill up the Raymond James Stadium 8 times over, you'd still have overflow. It's a lot of people, and it is more this year from previous ones. How that relates to the federal poverty line is the ALICE threshold. And what it is an income threshold of how how much money you need to make to get by. And it looks at the work that we're doing. So, I mean, essentially, it just shows that individuals are struggling in our community, and way more than what the federal poverty line would show with you, because it is a more accurate measure of how much it costs to get by.
All right, so that said, Doug, some people may think ALICE really only composed of workers earning minimum wage or below minimum wage, but that report says something different, right?
It does. I mean, it says it, you said in the beginning, we are ALICE. When we're talking at work at United Way, we know ALICE families that are police officers, that are nurses, that are in our community and doing our work, but are struggling. And when you break it down by the numbers, it really is a large swath of our population. 1 out of every 5 of our accountants and bookkeepers are ALICE. 1 out of every 10 of our nurses are ALICE. 1 in every 6 of our elementary and middle school teachers are ALICE. And this is the biggest one. More than half of all of our early education or childcare workers are ALICE. So these are families and workers that are taking care of our kids, taking care of our sick families that are struggling financially themselves.
You use that word threshold. Many people may not actually realize how close to that threshold, that line that they actually are, and how soon they may actually fall below that line. So when the United Way Suncoast says we are ALICE, as you just alluded to right there, it's definitely not hyperbole, but it really is our neighbors, our friends, sometimes us, and painful to admit that we are all in this together, but we are also known that this is the situation here. Groups that find themselves disproportionately impacted by this issue, that is something that can't go without being mentioned.
Yeah, Frank, definitely. The ALICE report actually breaks down demographics in a variety of ways. Specifically, we like to talk about the demographics broken down by household type, by age, and by race and ethnicity. We know by household type, families that are single parent families with children, especially single moms, are much more likely to be struggling financially. We know it's also true for households where the head of the household's under 25, but also for our seniors as well. We have seniors who are age 65 and over are also more likely to struggle in our communities. And then finally, we know that Black and Hispanic households are more likely to be below that poverty line and are also more likely to struggle when they're under that ALICE threshold as well.
Right, and I've covered some of those stories extensively as well. Now, the other word that we've used ad nauseum, pandemic, right? That has touched everybody, as I mentioned a bit earlier, but a lot of families, a lot of folks out there taking advantage of programs because they have to. But, now some of those programs have dried up. So as we look to the future, what does that mean?
Yeah. So, the unfortunate reality right now is that, we are on the tail end of the pandemic health crisis, right? But the pandemic economic crisis is continuing, and it will be felt for a while moving forward. And the problem that we see is that a lot of individuals are struggling economically from the pandemic, but there aren't the same benefits that were there, for example, in 2021. You take 2021 to 2022, for example, and back in 21, we had those economic impact payments. We had child independent care credits, child tax credits. And you mentioned that family of 4 that has the 1 kid in preschool and the 1 kid, slightly younger. If you look at that family, that same family that you mentioned, we know that between 21 and 22, they actually lost $10,000 in credits. And so that's $10,000 less that they have now, but they're still struggling. So again, when we talk about what the pandemic impacted our families, it made things harder to get by. And families that were struggling before are probably struggling more now.
$10,000, you say? $10,000? That's a lot of money, but as we talk about inflation, Doug, it doesn't go as far as it used to. I've got to ask you this as we wrap up this first portion. Got to close by noting that we know that this issue has been pervasive for some time, and we know a lot of factors are involved. You mentioned just some of them, but it's a long list, including childcare, education, workforce development, transportation, health, mental health. That really took a toll on folks, and they didn't realize how deep in the throes of struggles they may have been. What's required from the community to bring about solutions?
Yeah, and we talk about this a lot at United Way Suncoast is, well, where do we go from here, right? We can look at the data, we can see what it means, but we have to take action. We're inspired to do something about it. And the answer that we found, if you have 615,000 households, you need to make sure we have 615,000 solutions, right? The magnitude of the problem is large. So the magnitude of our solution has to be commensurately large. When we talk about what to do at United Way, it's not what is the solution, but how do we take every solution and bring it together to be addressing those families in our care, right? And so that means that it's policy, it's small business, it's nonprofit, it's corporation, it's each and every one of us coming together saying, how can I come together, put myself up to the plate and say, what can I do to build this up? So when we're talking about solutions, it really needs to be, how do we bring together everyone around the table so that we can all do our part to start addressing this problem? Because, it's big. Moral of the story, it is a big problem and we need to do something big to solve it.
The solution must be as big or bigger than the issue that we're facing, or issues in this case. Thank you so much.
Thank you, Frank.
No doubt. Now, as we bring in our panelists to deepen the discussion, I want to introduce them. All right. So they've got some lengthy resumes here, and for good reason. First up, She's a director and principal advisor on Atlanta's Federal Reserve's Community and Economic Development Team. Now, in this role, she specializes in the identification of structural barriers and solutions to career advancement for low-income working families. Before joining the Atlanta Fed, she worked in various capacities focused on improving outcomes for children, youth, and families, including serving as Florida's Child Care State Administrator and heading up the Florida Children's Council, the umbrella organization for children's services councils statewide. She has a long history of working with businesses, leaders, and policymakers to develop strategies that support pathways to economic security and improved outcomes for low-income working families with young children. And guess what, y'all? She's a native of Sarasota. So please welcome Dr. Brittany Birken. They're clicking their mouses right now. That's how they're showing their appreciation for your presence there. Next up, we are joined by a man with an extensive background as well in information technology, though, and cybersecurity. He holds a master's in management from St. Thomas University, and he now uses his business background, his care for children, to guide the Early Learning Coalition of Hillsborough County as its CEO. So y'all say what's up to Dr. Fred Hicks. What's up, Fred?
Good morning. Good morning.
Good morning. And finally, we have the current Vice President of External Affairs for AT&T, a former Florida State Representative. Now, he holds a Juris Doctorate from Stetson University and is the incoming chair of the board at St. Leo University. Please welcome Ed Narain.
Good morning.
Good morning. So before we begin with our questions, we want to jump in and invite everyone who has joined us this morning to submit those questions that they may have as they listen in on these conversations and say, wait a minute, I want to know about this detail. What about this wrinkle? We want to encourage you to use that Q&A function on the webinar. After that, I guide them through a series of questions, and then we're going to invite our panelists to answer some of those questions that you all submit. So we'll get to your questions because we want you guys to be engaged as well. So we'll jump off with this right here. I want to focus on early learning, childcare workers. We know they are the workforce behind the workforce, if you will. Yet many struggle to make ends meet for their own families with a median hourly wage of $12.80 in Florida. That's the hourly wage, not even 13 bucks an hour. And that was data that was grabbed in 2021. 53% were below the ALICE threshold. So Fred, we know you specialize in this category as well. Can you talk about the challenges facing early learning educators and how that impacts the broader needs of ALICE families?
Yes, thank you for the question. Many of our early care and education professionals, don't receive the recognition. The focus is on K through 12, but when parents have an infant, 1-year-old, and they drop that child off in order to go to work, they leave them in the care of our professionals who they themselves make less than $14 an hour. Here in Hillsborough, they may also have a child and their own childcare costs well exceed $1,300 a month. With that type of complexity, it is a challenge for our childcare educators to focus on, let's say, 10, 20 children simultaneously throughout the course of a day and worry about their own bills. When they go home, they sit and try to figure out, how do I put food on the table when food for a small family can cost over $600 a month? How do they maintain their transportation? We've had a plethora of dollars sent down from the American Rescue Plan Act to assist, but those dollars are about to dry up. When the American Rescue Plan Act dollars dry up, teachers won't receive the additional incentives to maintain their budgets, to maintain their teaching credentials, to gain more. And we will see, in my opinion, a huge crisis, not just here in Hillsborough, but across this nation, the same level of crisis that we felt when the pandemic hit, when childcare centers in many parts of the country closed. People couldn't take their kids to work. Now we're going to have the opposite being true. They won't be able to take them to work because there's no worker there. It's not that there's a pandemic, but the teachers are sitting there. I have empty classrooms spread across Hillsborough County, and I have almost 2,000 to 3,000 teachers who are struggling themselves to make ends meet. ALICE is real. When we say we are ALICE, I can point to that entire population and say, we have a lot of work to do. And as the United Way pointed out, and thank you for that presentation about the plethora of fixes that are necessary, we have to ensure that every person is at the table to help address the concerns in early care and education. And we have to do it fast. because 90% of the brain develops for every child by the time they turn 5 years old. If that is true, and I promise you, scientifically, it has already been proven to be true, we have a short period of time to fix this. It's like obtaining a college bachelor's degree. We have 4 years to get that child up and running. Every minute that we are not doing that, we are wasting our future, not only economically, but for our leaders of tomorrow. These kids need our help today. To help our kids, we have to help our childcare workers. ALICE can't be a reality for our childcare industry. We have to find other clever ways to fix it. So before you ask the question about what are some of the solutions, let me throw out a couple. Ready? One, working collaboratively across systems. This report helps to highlight some of the urgent need that is necessary. When we pinpoint early care and education and childcare, we focus on not only the children, but those who watch our children and who teach our children throughout the course of a day. So second, we have to worry about their healthcare needs. I've reached out to large Florida entities and asked for assistance to help those early care and education professionals get the necessary healthcare and dental and vision that they need, because what people don't know is less than $13 an hour in most cases also comes with no healthcare. And that's huge. Teachers have to be healthy in order to take care of the children, right? That makes common sense. Third, we are asking for everyone to understand that this early care and education group are experts at what they do. They are our teachers. If we can work with our advocates and work in Tallahassee to confirm that we need to protect this group as much as we protect our teachers through K and 12, we win. That's not going to be a trivial task. We need to understand, and everyone needs to understand, that we don't use the D word, and the D word is daycare. It's not daycare. Our children are learning, and they're learning through play activities, and they're learning through partnerships like we have with the Museum of Science, like the Glacier Museum, Mosey, who is recently joining us, and Zoo Tampa to help those cultural experiences. And last, the solution of all solutions, our parents, teachers first. Our parents are our child's first teacher. Give that teacher in that early care and education space the respect of taking some of those tips home and work with your child, because then we begin to break the cycle of ALICE. And that, I think, is our long-term goal, right? 10, 15 years from now, fewer people in that space because more education has been obtained, and we start now. 90% of that brain happens now. We have to jump on this right away. And last time I checked, we are in Tampa Bay area where champions are all over the place. I just watched the Rays game. Come on. I need everybody's help. Join me in fixing this.
Hey, the Rays are on a historic pace this year too. And what I'm hearing from the picture you just you reflected back to us, this is a compound fracture. And so it really hits hard. I want to go to Brittany now, because Brittany, we know life can be difficult for early learning education, but United Way Suncoast and other organizations, they focus on early learning. We don't use that D word, right? I just learned something new. We do not use daycare because we are learning as we move through. We don't just warehouse people. We want to help them help us. And so United Way Suncoast and other organizations focus on early learning because it can fuel solutions for ALICE families. I want you to tell us about the two-gen approach in early learning and how it can not only help children, but lift up families.
Yes, thank you so much. So great question. The two-gen approach is an opportunity and a framework for thinking with equal intensity about outcomes for young children, but also the adults in their life. And this is really important because children's development is inextricably linked to household financial stability. And as Doug aptly described in the start of all of this, ALICE family is not necessarily financially stable, right? Challenged with the money they need to maintain their basic budget and expenses. And so the opportunity with childcare is it does support the young children's development to make sure they're ready for kindergarten and later grade success, but also is a big workforce support for families. And this is important. Nationally, 37% of the labor force are working families with children younger than 5. So if you think of a third of the workforce likely needs childcare, that really underscores how important childcare is for working families and the ability to participate in the labor force, the ability to move, through their career pathways, And we know historically there are challenges with childcare, both in access, as Fred described, but also in affordability. And those challenges can sometimes really complicate families' access to childcare and ability to fully participate in the labor force. So addressing childcare is an opportunity to think as a two-gen strategy, because it's supporting young children's development, but it's also very much supporting the adults' abilities to participate fully in the workforce. And last, I would be remiss if I didn't mention equality is really important because it has been linked to productivity for adults. So not just in supporting young children's development, but if I, as a parent, know that my children are in a quality childcare setting, I am going to be much more focused on my work. I'm able to be on time. I'm able to really maintain my focus there. So on a lot of different levels, childcare is a really significant opportunity to think with a two-gen approach and think longer term about economic mobility, as Fred said, well, for the workforce today, but also longer term.
That part right there, you are telling the full truth. Whenever home is not right, if you're at work, you can't focus on work at that time. Thank you so much for that. And Ed, you're a former member of the Children's Board of Hillsborough County. So I know you understand the importance of caring for our children out there, but are we seeing enough understanding about its importance from employers, as Brittany alluded to just a moment ago? And can we look at them and look to them to help us with that situation as a whole?
Well, thank you, Frank, for the question. I think what we're starting to see is a little bit of an evolution when it comes down to how businesses look at childcare needs for their employees. For the longest time, mental health, for example, was something that wasn't discussed by businesses, that was seen as a private issue. But over time, you started to see that mental health issues affect the employee, which affect the business. And now you're starting to see the same thing with a greater awareness of the need for improved access to childcare for employees. There's a lot of things that companies could be doing, but there isn't a one-size-fits-all approach. I think oftentimes we talk about these things in generalities, and we don't think about the fact that the majority of businesses in our country are small businesses. So, what a company like mine can afford to do in terms of offering, for example, an expanded parental leave policy may not be something that the average small business can do. But what you find is a lot of small businesses don't have any policies as it relates to parental leave. One of the great learning lessons from the pandemic was this idea that we can all get on our iPads and still be productive in a meeting, right? We're actually having a virtual forum right now. So the use of technologies like Zoom and Teams have made it so that people can actually work from home when they need to. And I think what you're seeing a lot of companies do is a reevaluation of jobs, right? In the sense that, do I need this employee to actually come to the office every day? Do they need to actually be on site for our company to be productive? And I think what you're finding is, because of technology, we've shrunken the distance that you have between employees based off of where they live. How does that help? Well, obviously, if you have young children under the age of 5 and you're not in a financial position to put them into a high quality, and that's the key thing, high quality childcare experience, then you have the opportunity to maybe do like my mom did and be home with me and my brother until she decided to go back to the workforce. But in today's day and age, the type of job that she had, she could have done that remotely while she was home with us. So we do live in a time where if we learn to leverage technology, businesses actually can still be productive and help employees with childcare needs. Some of the larger businesses can probably afford to do things like flexible spending accounts for childcare, where people could take a portion of their income and actually save that to be able to pay for childcare. This helps in 2 ways. One, the money is put aside for it, but it also reduces the tax liability of those individuals. So now they're not paying as much on their federal income taxes at the end of the year. So it's a win-win for everybody. But it is a tough issue, but it is something that I think is a manageable issue as long as employers are willing to be flexible, listen to the needs of employees, and then make the proper adjustments to assist them with childcare. The last thing I'll throw out there, because I'm here with Dr. Hicks, is, companies, big or small, can create a referral network for high quality early education. That is, to me, one of the things that's like low hanging fruit. Oftentimes people find childcare facilities that are either closest to their home or closest to their jobs, and they don't think about quality first. So we need them to start thinking about quality, especially when you hear that, 90% of the children's brain function starts from 0 to age 5. So we need to make sure that early childhood is something that we're teaching employees about, the importance of it, but a referral network is a very simple thing that most businesses can start.
The operative phrasing that you used right there, listen to employees, right? We can certainly find some solutions out of that. I want to talk more about the business community and how it can help Alice families. A lot of people out there say the solution is simple. Companies just need to pay a livable wage. That's relative as well. As we talk about, everything is going up right about now. But while we've seen the minimum wage increase in this state, the cost of basics, well, that continues to outpace earnings, keeping the cost of well above the federal poverty line. So, Ed, what is the perspective of the business community when it hears companies just need to pay people?
Well, I think, oftentimes the majority of the companies that are out there, when you say, well, just increase my salary, and that'll fix everything. Most businesses rather, tend to kind of meet that with a collective eye roll, right? It's not that people shouldn't make more money, right? It's the type of jobs that people are in and what you're actually paying for. So if you're looking at the low skill entry level jobs, those are not necessarily jobs that people should be commanding, 6-figure salaries for. But we should ensure that we're paying people a livable wage. In other words, enough money that they're able to work full time and not still be in poverty. Unfortunately, that's not something that is going to happen overnight, which is why many years ago, the US government started the Earned Income Tax Credit. One of the problems with that is that you haven't seen the Earned Income Tax Credit really be expanded to keep up with the pace of inflation in our country. So we've got to look at solutions like that. The statistics that you threw out earlier, I can't remember if it was 88,000.
88,000.
I mean, if you really think about that, in order to qualify for the Earned Income Tax Credit, you have to be making between 46,000 and 63,000 as a family of 4. So we're still way off. We're about $25,000 off from helping people really have a comfortable living experience despite working full time. So, it's unfortunate, but I really do believe that we should be making sure we're paying people a living wage. But we have to be careful about what jobs we're, saying, okay, this person should make $20 an hour for, especially if it's something that no skill is required. We just have to figure this out. We have to grow our economy from the middle out. Too many people today, unfortunately, are working jobs that teenagers used to work in the past. So high skill, high wage jobs is what we should be aiming for. And if you're an employer out there, you should be trying to retrain your workforce so that you can justify paying people increased salaries.
No doubt. Here goes that word again. So as I mentioned before, we have seen the minimum wage, that word right there. We've seen it climb and in certain industries increase in salary. But Brittany, sometimes pay increases hurt Alice families out there. Some employees turning down raises. So can you dive into that phenomenon?
Yes, absolutely. So part of my work and research at the Atlanta Fed is focused on this very phenomenon, which are referred to as benefits cliffs. And these present as real barriers for lower wage workers that are working on career advancement opportunities. And so a benefits cliff happens when families access public benefits, whether that's childcare subsidies, housing, food assistance, to help meet their basic household financial budget needs. And as they experience modest wage increases, the value of that public assistance will either decline or families can lose eligibility entirely. And that can leave them financially worse off. Some of you may have heard me tell this story before, but we were just talking about childcare, and it's a really relevant example. When I served as Florida's childcare state administrator, received a call from a parent. She had received a 10-cent hour wage increase offer from her employer. And she said, if I did my math right, that $200 some odd a year is going to mean I lose access to the childcare subsidy voucher system. And so that $200 a year, she had 2 young children, was going to result in a $9,000 financial net loss because she was not going to receive childcare assistance anymore. And she said, what do I do? And I said, I can't tell you what to do, but that's what started me down the path of really doing research on wanting to understand these benefits cliffs, when they occur, for whom they occur, how they vary based on where you live and the cost of living, how they vary based on your family composition and different career pathways. And ultimately, different public assistance programs have different eligibility requirements and cutoffs. So it's a very complex topic, but overall, this is an issue for workers who are working on economic mobility. It's also an issue for employers. The Florida Chamber last spring surveyed 1,000 businesses, and 1/3 of employers in Florida identified that they had had employees turn down wage increases or job opportunities. So this is also an industry or an issue for talent development in our state and employers, and certainly has implications for broader economic development. But that phenomenon can present as a real critical barrier to families who are working on career advancement. I say families because if you think about it, the household financial needs of an individual are very different than families that have young children. When you think of costs like childcare, when you think of health and housing and food, there are just going to be differences. And so part of this is beginning to understand, when do those barriers present? How do they present? And how can we begin to address them to support increased economic mobility?
Essentially losing because she was winning a higher wage.
Correct. So it forces families to choose between their very immediate real needs financially and for their children's development and their longer term future career pathway and career advancement opportunities.
Complex, but the context is definitely everything. Fred, you bring years of business and management experience to your role with the Early Learning Coalition. So from that perspective, how do you think the business community can do a better job of supporting ALICE families out there?
Many of the challenges that we discussed so far this morning are real, and businesses have to make real answers. One of the answers is we can assist with childcare at a business level, make that a benefit. And what I mean by that is offer employees the ability to have a childcare pool of money that they could choose from. So if a parent is working at your office and you have set up, much like you set up your healthcare benefit, you set up a childcare benefit that they could use monthly and draw down dollars, that would help them tremendously to stay on board. The next is professional development. Many of our early care and education professionals have to go through multiple trainings. Each time there's a training, one can anticipate better customers and better revenue. So earlier we heard comments that we could leverage a referral system. Those are wonderful if the employee feels empowered and a part of it, right? So involving our employees and listening to their ideas helps tremendously to help with everyone's growth and development. The challenges that businesses face to one year after another afford affordable healthcare is real. Perhaps pooling all of those together in small businesses to go after some of the large healthcare entities to get better numbers helps us all across the board. So my conversation with Florida Blue, for example, has yielded the possibility of them coming up with an idea that provides early care and education professionals with healthcare, dental, and vision, which are critical for their success. Our ALICE families who work in hospitality, who work in transportation, who work in some of these entry-level positions can also be assisted if we work on education for them. A lot of entities are saying, hey, we'll pay for some of your student loans if you go back to school and gain more skills and elevate yourself. When employers can step in and help, employees will rise to the occasion because, like Brittany pointed out earlier, families want to succeed. People don't come to work with the notion of, hey, I just have to work. They want to succeed. Everybody wants a piece of this American pie, and there's plenty of it to go around, and we all have to work as a team to get us all across that finish line.
Yes, we do. I'm going to do my best to keep us on time here because we have a lot of great information and a lot of solutions which you all have provided over the last 37 minutes or so. But before we start our final segment here, we want to invite everyone out there who has joined us, and I've seen some of those questions come across the board. I want you to submit your questions you may have for the panel there. You got to use that Q&A function on the webinar and our webinar, I should say. Now, after I guide them through the series of questions, we're going to invite our panelists to jump into those questions for some quick responses. So as Doug noted earlier, it's going to take every entity in our community, and you just pointed this out as well, Fred, it's going to take every entity in our community to reverse the ALICE trends, help families cycle up. That includes our elected officials and our policymakers. So Ed, as a former state legislator, want to start this discussion with you. We've seen some movement in Tallahassee regarding affordable housing and the kids' care bill, but what more can the government do to help folks out?
It's a great question. And you want to keep us on time, right?
Give us the abbreviated version if you can.
So, let's start with the elephant in the room. Florida is now just one of 10 remaining states to not expand Medicaid throughout the country. And so when you consider that, most people who have a catastrophic situation financially, it's due to someone's health going bad, whether it's a heart attack or a stroke or something else. That's what impacts families financially the most. And it is very difficult for a middle income family to recover from a situation like that does have healthcare. So now put yourself in the shoes of an Alice family that doesn't have access to healthcare. And what does that situation look like when a breadwinner loses time at work simply because they had a health issue? If Florida would have simply expand Medicaid access, you're looking at anywhere from 850,000 to 1.2 million Floridians that could have healthcare coverage that today do not. That is strictly at the feet of the state legislature and the governor. And we're just one of 10. The other 40 states have accepted. I think a couple of other things that we can do, you heard me mention earned income tax credit eligibility. I believe that the federal government needs to expand that and increase that. It's still too low, especially the inflationary period that we're in right now. It is very difficult for families to make ends meet. I think by providing an increase in that, you can pull more families out of poverty. I think you need to incentivize companies to retrain workers for the jobs that are actually out there today. That's easily done through tax credits. As we move towards solar power use and electric vehicles, there are ways that the federal government, along with the state government, can incentivize that type of employee retraining. And then finally, I'll throw out there that I think when it comes down to the other elephant, affordable housing, local government needs to do more to incentivize builders to build housing that's I'm going to change that from affordable to workforce housing, where people can actually afford to live in there. Right now, the majority of people in our state have seen increases, yes, due to insurance, but also, if we're going to just call it what it is, greed. There are a lot of landlords out there who have raised rent anywhere from 25 and as high as 200% over the last year because the market is demanding that. And I just think that's greedy, it's unfair. And if you're a family out there that's struggling to make ends meet and you see that type of increase in your rent, you're not going to be able to survive. Local government needs to step in that situation.
Yeah, and without a cap on that situation, it really hits the pockets hard for unexpected expenses. Anything else that you want to see? Because I know you got a list there. I saw you jotting away. Anything else you want to throw in there for?
Well, I'll tell you what, there's a lot of times we look at government and say it's just government's responsibility. I believe, and we saw the Business Roundtable back in 2019 start to pivot towards this. Our CEOs and business leaders need to adopt these issues as their own as well, because they do impact and affect their employees. And I think the most reasonable example that I can give you is over in Orlando, where Universal Studios and Walt Disney Studios have actually taken parcels of land that the government has helped to give them, subsidized somewhat, to actually build and create affordable housing for their employees. Now, long term, I don't know how that's going to work out, but that's an example of business working with government to tackle one of these hot button issues.
I know when I go to pay my rent next time, I'm going to say, Ed said lower the price. That's what I'm.
Good luck with that.
Thank you, sir. So the Atlanta Federal Reserve has developed a cliff planner, a tool that helps identify fiscal cliff issues. Some communities have created programs out there that provide wraparound service and supports, providing support for employees who are experiencing temporary deficits in their net resources because of career advancement. So Brittany, can you explain how that works and why we need more communities to provide those wraparound services?
Yes, this goes back to the last question that you asked me and understanding barriers to economic mobility. And so we've developed a suite of tools to help identify benefits cliffs. When do they occur? For whom do they occur? How do they hit? How do they affect different career pathway trajectories? And communities can use those tools and other resources to better understand what are the barriers related to transportation, childcare access, which we've talked a lot about today, and how those benefits cliffs can stymie career advancement. Communities can look at both government resources, also nonprofit resources, and think about how do you organize those and begin to target funding so that we can support economic mobility. So whether it's as workers are enrolled in additional training and education opportunities, or post when they're actually in job placement and beginning to experience different wage increases and things that may put them in a position to experience a barrier, how can communities think about wraparound supports differently and the resources that those workers ultimately will need to kind of move up and over that ALICE minimum household budget threshold to a more financial stable state and place. And so there are many communities that are beginning to work and think about holistically, what are these barriers and how can we systematically use resources to address them and support increased economic mobility?
Systematic resources there. And the feel of this entire conversation is empathy. So at this point, I want to turn to some of the questions we solicited from our friends who are out there listening. They certainly appreciate your efforts. This friend of ours did not leave a name. It's all good, though. They said, this is not a question, but a statement. I truly appreciate your transparency and this discussion. This benefits cliff is huge, and I can tell you, I see it. I'm going to tell you all, and we're all in different circumstances, but when you talk about the rising rent prices, for me, moving from out of state, I saw year to year a 32% increase. So I'm here to vouch that that is real. So I'm going to do my best to pronounce here, and I left my readers in my car. So y'all forgive me, okay? So Katie Scaglione says, do we have figures on how often people are turning down raises because they'll lose government assistance? We talked about this a little bit earlier, but there are people behind those numbers. Anyone want to jump in on that particular question from Kate?
So this is an issue that's still really being actively researched and explored. I will give an answer from Alabama recently did a pulse survey, and they found about 30% of workers had acknowledged that they had turned down wage increases, which lines up with the statistic I gave earlier, right? About the Florida Chamber saying employers had about 30% of employees turn down wage promotions and statistics. And so while that is not universally true, that's an indication that it is a decision and a dilemma for about a third of workers that have acknowledged they felt more that it was in their better interest not to advance in their career in that moment. And that's part of why we're working to really see how we can address this so we can support increased economic mobility.
That is how real the struggle is. And JFCS development, more of a statement here. Skyrocketing housing costs hit all households and makes families' expenses even harder to navigate. Retirees can't look forward to advancing a career. They're on a fixed income. A housing crisis is here for this population. And we are seeing people move in droves into the Florida communities. So new, quote, affordable housing being built is not affordable. How can this age group be helped? And Ed, if I'm correct, you said affordable housing, right? And branding that and calling it what it is.
Yeah, we say affordable. So the question that's in the chat there about, our senior population, for example, when we say affordable, they would fall under that affordable umbrella. But, the focus of today was the ALICE population. And that's why I want to make sure we can't just say affordable. We're talking about workforce, because those are individuals who are in the workforce, but are struggling to keep the housing that they have or find suitable housing because they just don't make enough money. So I wanted to create that distinction so that we're talking about it in the right terms. So workforce is one thing, affordable is another, even though they're both under the same umbrella. I don't know that I know the answer to that question, right? I do believe that our local governments, our state governments can do more to subsidize housing overall. There has been pushes all across this state for rent control. That is something that Tallahassee has blocked from actually happening. So even if your cities were to pass different types of rent control, they're preempted by the state from actually implementing it. And that's, an example of where policy state policy impacts local policy, right? Because ultimately the state has the ability to say, no, you're not going to cap increases. But I do believe that's where we need to go to prevent some of the greed that we see happening with landowners and apartment owners around the city and around the state. How you actually get that done is the difficult part.
Yes, that's always the difficult part. And Fred, I've got something here for you. It's something of a three-parter. And we start with this right here. How can we elevate salaries for early learning workers by increasing state reimbursement rate for high quality early learning providers? Again, they say high quality early learning providers. Also, why are the child care subsidies for Florida so low compared to the rest of the nation? And finally, what direct advocacy can be done? I see you nodding to all of these because these are bullet points that you've come across on a daily basis.
Absolutely. So I want to tackle the first one, which deals with how can we ensure high quality educators get more dollars and increase their base pay. One, it starts with the recognition at the top. So from Tallahassee down, if we can get that recognition that these teachers are in fact teachers, then we start winning. The research already shows that, yeah, learning happens at age 0 all the way up through 4. By the time a kid sits in kindergarten, if they're in a high quality center, they're going to succeed more so than students who don't. So the recognition is key. Second, we're going to have to find additional dollars. Many of our owners are struggling to have enough heads in the room and ensure that our reimbursement rate from the state level down, which is now set by the state, helps. The current reimbursement rate is just too low. And that bleeds into the third answer, which is advocacy. What we have to advocate for, and we're going to march down this path in the next session, you'll see us more dollars in that base allocation. The state recently has a budget proposed where they have added dollars for that base allocation. But if we look at the voluntary pre-K allocation, it's just too low to really be fruitful for our teachers to make $15, $16 an hour. So we're going to have to advocate for more. If we can do that, we all win. And I know we're short on time. If we had a little bit more time, I would tell you how you should reach out to your local legislator and contact our office as it relates to supporting our initiatives and make those phone calls so that when it starts the next session, be there and be present. Make those phone calls. Join us in Tallahassee. Reach out to your local child care center. Go and visit one and find out what those struggles are and help us.
A chunk of answers for some solutions there. Thank you so much. And as we wrap this up, as we want to stay on time there, I want to give each of our panelists a chance to give us their closing comment. And Fred, I'll start with you.
My closing comments are, one, I appreciate this conversation. And I love the fact that everyone is going to walk away with this number. 90% of the brain develops by the time a child turns 5 years of age. But I'm going to give you a second number. If we don't fix childcare, it was recently reported that $6.6 billion in revenue is being lost in the state of Florida. So business leaders, I'm calling everyone out to the table. We need everyone's help. If we can win, now is the time to win big.
Absolutely. And Brittany?
I just really want to thank you all for the opportunity to participate, and in particular, the partnership of the United Way, the United for Alice research, really shedding a light on the key issues that we've been unpacking and discussing today, and the opportunity to start the community conversations that are so critical to identifying potential solutions long-term, both policy, system, finance, but really all begins with community conversations. So just wanted to acknowledge that and share my appreciation.
No doubt. Ed?
And I too just want to say thank you for the opportunity to participate in the panel today. We've blamed a lot on the COVID pandemic the last 3 years. And if we're going to be completely honest about this particular issue, we were dealing with the pandemic of poverty in this country long before we saw COVID-19 reach our shores. So at this point, we have to figure out whether or not we're going to, kind of shuffle this under the rug and look past it and say, well, the federal dollars are gone, so there's nothing we can do about it. Or are we going to get the collective will to work together? And when I say we, I'm talking about the business leaders, with our government leaders, with our community leaders, to come up with a comprehensive solution to address these issues. I'm a firm believer, growing up in a working class household, that no one who works full time in this country should live in poverty. And so we've got to figure that out together. But I just want to say thank you to the United Way Suncoast for helping to lead the charge on that.
Thank you. And Doug?
Yeah, I mean, Ed nailed it right there. I mean, it is everyone coming together to build this up. And I would just reiterate that United Way Suncoast is here to help. And we're happy to spread this information and these data to anyone who wants to hear it. We're happy to bring people together because, again, just as the powerhouse of these three have been saying, it takes all of these different avenues and all these different approaches to address this work. And so it's not who's going to do it, but how are we all going to do it?
I think you all summed it up perfectly, and I apologize if I could not get to your questions. I certainly saw a question here about tipped jobs, restaurant workers, hairstylists, luggage handlers. That is exemplifying how extensive this problem is. There's not enough time to dive into every aspect, but I can assure you the United Way Suncoast is here to try and rectify some of those problems with some solutions. And I must say thank you all for allowing me to facilitate this conversation. I intend to cover some of these topics on my morning show on Brightside, as well as my podcast. So you can download that, A Frank Conversation, wherever you get your podcast. We dive into topics like this all the time. So again, thank you for spending the morning with us. But at this point, I want to bring forward CEO of United Way Suncoast, Jessica Muroff. She hung out with me on Brightside a couple weeks ago, as well as on the podcast. What's up, Jessica?
Hi, Frank. First of all, I just want to say thank you. You have just given us tremendous support, not just this morning, but as you mentioned on your morning newscast, you are a true community champion. We are grateful. We're also grateful for our panelists, Dr. Brittany Birken, Dr. Fred Hicks, and Ed Narain. Thank you for making time for us. And I also want to thank our United Way Suncoast team. My goodness, we work with the best team who helped bring this presentation together. Doug Griesenauer, Jessica Maxenbarrier, Brittany Bruns, and especially our dynamic data team, Josh Dunn, Julia Goldman, Aaron Neal, and our newest member, Ryan Lewandowski. We talked today about the data emerging from our 2023 ALICE report, and it clearly presents, as you've heard this morning, snapshots of challenge, of struggle, and of uncertainty. And it's families who are counting the days between paychecks and hoping nothing goes wrong. It's young adults making decisions between food and other essentials or having the dollars to pay their rent. It's mothers opting to stay home because they can't afford daycare. It's fathers putting dollars into the household budget instead of putting them into a retirement account. And it's seniors stretching a discounted meal from one meal and one seating to three. And as a community, we have to add hope to all of these images. We have to enhance them with solutions. We have to improve them with answers. Each and every person, business, government entity, nonprofit, and caring individual has a responsibility to create a better picture because we're all in this photo. We are ALICE. And the best way to help involves marshaling our resources and uniting the community behind a collective effort. And that's what we're so good at United Way Suncoast. And it's something we've done for nearly 100 years. And that's what we're aiming to do today. When we unite as a community, we stem the tide of turmoil, just as we have done since our founding in 1924. And when you stand with us, you're not only helping deserving families, but you are empowering United Way Suncoast to convene stakeholders, leaders like you saw this morning, and utilize the resources that create long-lasting solutions. And if you want to learn more, and I certainly hope that we'll answer some of the questions that we didn't get to directly from that chat, but please visit our website and our ALICE 2023 webpage to learn more about what we're doing to empower our community and how you can help. Because as we say every day, united we rise, united we win.